Stewardship to us is looking after our patients. We shop locally in town where we can.
It's interesting because it's a dietary team as well as a dietitian, and to see them working together to do meal planning is one of the things that stands out for me to ensure that the residents are receiving what they need without having that waste. Being in a small town, recycling is very limited, but they do the best that they can, and they do it in their spare time. And it's an entire team, it's not just one individual that does that.
I started in 2014 April. I actually felt the need of making some serious changes, and when I actually brought that up with my staff, the support was tremendous.
We've recently started making all our own soups from scratch. We save the peelings from the vegetables and we make our own stock. We've also lessened the disposables we use in the cafeteria. We're using glass dishes, so it's better for portion control and for the environment.
The whole program is designed to use our resources most efficiently, and the result of it is that patients are now being able to be seen twice a day instead of once a day. So we're doubling our capacity in terms of their physio treatment with minimal addition to staffing.
We bring max 10 patients into our program, so when they come into this program, they're sitting with people that have gone through the same thing. They're not alone.
John has been a board member since 2002, so he's been sitting on our community board since then. He's also the foundation board member's chair. He's always there for us. Whenever we have an event, you can count on John to be there. And not just John, he's managed to recruit at least 15 other people. John is probably the most enthusiastic volunteer we have at St. Michael's.
By fundraising, helping with the Harvest Moon Ball and a couple of other activities, the money that goes to purchase various equipment, that definitely helps the patients have a better quality of life.
He's worked very, very hard to make our patients' lives a lot better. And by making our patients' lives a lot better and working with our staff and working with our patients, he's actually decreased the length of stay for our colorectal patients here in the hospital. In our first year, he saved over 500 patient days for colorectal.
One study, for example, shows that for every additional liter of IV fluids on the day of surgery, complications increase by 32%. If we can avoid those, we save a lot of money, we save the patient a lot of hassle, we save our nurses time, we save in every format just by giving the patient a more higher quality experience.
She has stewardship by doing preceptorship to the new healthcare aid students. So she's making sure they learn the best, even though knowing their weaknesses and strengths, she'll make sure they learn.
I am involved with the hand hygiene project with the infection control. I have done the internal audits in the building.
She was in charge of ordering the Incontinent products for us, and she would make sure they are under budget or over ordered. Then she'll make sure she'll balance that out for end of the week.
So I have to think about what is needed for the patients. So when I take it things, so I want saving time and quality, and then also for using their resources. So unnecessary, we're not wasting their unnecessary resources.
She does just some throw things when it's not necessarily to throw things like the brief. She think first before she apply all the dressing, and she will see first which one is going along and working for this patient.